Erick Aguinda and his family live in a small village in the Amazon basin of Ecuador, in an isolated region known as Chontapunta. Before arriving at a Timmy-sponsored medical clinic, the family knew that their 3-year-old son was ailing, and badly, but had no idea of the magnitude of the problem. They heard about Timmy's medical clinic, organized in partnership with the regional government of the Amazon's Napo province. Knowing that something was wrong with their son, they traveled more than 2.5 hours to Tena, a city where Timmy was hosting a joint medical team with Hospital Metropolitano. Physicians who reviewed Erick's case noted that his liver was badly swollen and his heart was failing. The Metropolitano doctors gave Erick a grave prognosis. Without an extremely difficult and costly operation involving a new heart valve, the child had less than a month to live. Without access to resources or the necessary prosthesis, the doctors from the best hospital in Ecuador were not optimistic about Erick's future. But working with those physicians, Timmy decided to adopt Erick as one of our special solidarity patient cases, and rushed him to our partner hospital in Quito. Timmy worked with the Hospital Metropolitano to get Erick hospitalized as quickly as possible, and arranged for cost sharing of all expenses associated with the case. After a week in the hospital battling pneumonia, Erick underwent a successful operation with his family by his side. After a week of recovery in the Quito hospital, Erick was returned to Tena with instructions that he receive follow-up care on a regular basis. Along with representatives from our local government partners, I have been to check on Erick twice, personally, and his family continues to bring him to Timmy-sponsored medical clinics in San Pedro de Sumino, the adopted Timmy community closest to where they live. The follow-up and logistical support is working, and the surgery has been a success. It's remarkable to listen to his family discuss the miracle that Timmy helped produce along with our local partners. They speak with such joy and optimism about Erick's future that it's not only heartwarming, but infectious. Erick is only 3 years old, and he doesn't even really understand who I am. In fact, when I visit him, he calls me Timmy because he thinks that that's my name. His family, on the other hand, is extremely grateful. They are amazed not only that we helped pay for the operation, but that there is someone willing to walk for an hour through the jungle just to see if Erick is still doing well. When I look back at Erick's case, it's amazing to know how the structure Timmy has put in place and how the passion of Timmy's amazing on-the-ground partners can take a low-income family from one of Ecuador's most rural, inaccessible regions and ensure that they get their son the care they need. It is this type of individual attention to patients that truly set Timmy apart and makes me proud to be part of this organization.